They don't have access to her entire medical chart. I'm in nurse mom mode. It's probably the closest thing Raylan will ever get to going to camp. Almost Nurse Abby, future Nurse Abby here. I'm going into my mom nurse mode. We are hopefully getting ready to go on vacation in less than 48 hours, and that means Raylan will get to go to camp Almost Home Kids. So it is a bridge hospital. I believe there's one nurse at least for every 3 patients. Plus there's techs and, PT, OT, speech there. It's a very low patient to caregiver ratio facility. It's probably the closest thing Raylan will ever get to going to camp. So I'm not too worried about her safety or care there. Like, she will have tons of eyes on her, but at the same time, they don't have access to me or Chris. Like when Raylan's in the hospital, we're always there immediately to answer questions. Say, this is what's normal, this is what's not normal. And they don't have access to her entire medical chart, like when she's staying at St. Louis Children's Hospital. So, they do have access to, they'll have all her doctor's names and phone numbers, and they can call Children's, but it's not just on their computer. All that to say, so I'm in nurse mom mode because I want to make sure we send Raylan with everything she needs for her care. Like, we have to provide her cath kits, we have to provide her medicine, even her over-the-counter medicine. So it's not like a hospital in that we bring all the stuff she needs. So I have to make sure we have all her supplies, her suction machine, her nebulizer, her shaker vest, her cough assist, all that. 2, I have to make sure it is very clearly documented. In my opinion, I have to make sure it is very clearly documented and easy for people to see how Raylan uses her equipment. So these people have used cough assist tons of times. That's probably a very common thing for kids at this facility to need. And what it is a mask that goes over her face. It forces her to breathe in, and then it forces her to breathe out. It's a fake cough. They know what those are for. They use them. Thing is, some kids use those to help them get gunk out of their lungs. And that's originally why Raylan had it. But usually that is not used for Raylan to get gunk out of her lungs. Usually her lungs are fairly clear where that's not the primary thing, and it doesn't make her cough up a lot of stuff. For Raylan, it's used to help her exercise her lungs and practice some deep breaths, because you can't tell Raylan, hey, let's practice some deep breaths. And her breathing sometimes tends to be too shallow. If they know that this cough assist is being used to practice deep breaths and get lung exercise, they're not going to be wondering why no mucus is coming up. If they are used to, seeing mucus come up when a kid does cough assist and mucus doesn't come up, and they don't know about Raylan, they might be tempted to deep suction and try to get mucus up, which the more we deep suction, the more we irritate her throat, the more mucus hangs out in her throat. So that's just something. It's not that they don't know how to use the cough assist, it's that we want to make sure they know why Raylan uses the cough assist, because knowing why Raylan uses the cough assist affects how they treat her while using the cough assist. Same thing with, let's see, what else? Her A-frame brace that she has post-surgery. No doubt in my mind, these people know how to put on and take off an A-frame brace. Raylan's instructions for A-frame brace from the doctor are to wear as tolerated. It has taken us trial and error, because Raylan doesn't tell you what she's thinking and why she's crying or why she's upset. It's taken us a lot of trial and error to figure out what Raylan comfortably tolerates from the A-frame brace. And we've learned, she mostly likes it on. We've learned that if it's been on a long time, she likes it off. But if it's been off for about 3 hours, she probably wants it back on. And when you put it back on, she gets very upset. It's usually, she does not like the feeling of getting it back on, but then once you get it on, it's fine. I feel like if you didn't know Raylan, 1, you might be taking it off too often. 2, you might get ready to go put it back on because she's fussing, and when she fusses that much louder, you might say, oh, never mind, okay, we won't do that. But we've learned, no, we should go ahead and put it on, even though it makes her really upset to get it put on initially. That's what calms her down. So they need to know that. They need to know, hey, after I've had this off for about 3 hours, 2 to 3 hours, I usually want it back on. I don't like you putting it on, but I will feel better after it gets on. They need to know that kind of stuff. That's not in nursing books. That's just a trial and error we've learned from taking care of Raylan. But if we tell them that, then they'll know and they won't have to go through the trial and error we did. What else? Her VNS magnet. So you scan that when you see seizure activity. It's a little matchbox-like thing implanted under the skin, and it has a little electrode that goes to her vagal nerve. And if you scan a magnet across it, it gives an extra electrical stimulation. That's something that's not very common. To be honest, it would not surprise me if some of the nurses there had never seen one of those. At Rankin, they were not familiar with it. So, we want them to know, one, like, this doesn't hurt Raylan when you do it. Two, when in doubt, go ahead and scan it, because the only negative thing of scanning it too much is it's going to wear down the battery, and that's a very small deal. Three, how we know when to scan it. So what signs we see that she's maybe having a seizure. That's different for every person. If I don't write a note to them, they don't know what it is. Four, so when Raylan has a big tonic-clonic seizure, you have to prioritize what are you going to do. If the magnet worked really well on a tonic-clonic, your priority would be to scan that magnet on her ASAP. The magnet works great at keeping a tonic-clonic away, but once it's started, it doesn't do that much, we don't think. So if she's having a big tonic-clonic, we want them to know, don't worry about the magnet. First, make sure she doesn't have her arm entrapped under the wheelchair arm where it's going to get bruised or broke. First, make sure you got the suction machine handy to get secretions up that she's choking on, maybe. Things like that. This is stuff we've learned from taking care of her. I also know if I gave them a care plan this fat of how to take care of Raylan, they don't have time to read that. They don't have time to read all these little things in a book. But what I can do is put short, concise notes in ideal places. So in other words, attached to her magnet is a short, concise note on when to use me. Attached to her cough assist is a short, concise note that says, does not usually cough up secretions. This is for lung exercise primarily. A note probably attached to her leg braces, literally, that says, I like this on most of the time, but sometimes prefer a 2 to 3 hour break. I will get upset when you put it back on, but then calm down quickly. Something like that. I need to label everything with short, concise notes because they don't have time to read a care plan thing this long, and they might not remember what's on something back at their nurse's station. But if it's literally written on her devices, it will be a good refresher. It will be a good reminder, but it has to be written so concise that they have time to read it. So my goal today is to label all of Raylan's stuff so that it's very clear as much as possible how we use the equipment, how Raylan uses the equipment, what to expect from Raylan's use of the equipment. Also meds, I was looking, one of her meds it's written wrong on the prescription bottle. It's old orders. And I need to make sure, do they have something dated with the new orders? And maybe I need to label that bottle and say, these orders are out of date. Please refer to med chart we sent from Advantage Home Nursing for the most up-to-date orders. And write it down there, but like proof. I need proof on there that a doctor gave the new orders on that prescription bottle. So that when they look what to give and it says half a tablet 3 times a day, they see my note that says currently taking full tablet 3 times a day, see MAR sheet and care plan. So they don't give the wrong dose med, because it's really easy to give the wrong dose med if the bottle tells you to give the wrong dose med. So making sure all of her medications are labeled correctly, or I've told them they're not labeled correctly and where the correct instructions are. Labeling her meds, labeling all her equipment stuff. I think those are the main things. I actually plan on printing out her most recent doctor's visit notes from some of her most recent visits and literally highlighting on them just a couple lines of the most relevant info. And I don't know, like, especially Raylan's oxygen issues at night, it seems like that's increased some. I want them to be assured, like pulmonary knows she's using this much oxygen at times. That's not abnormal. They need to know what's normal and what's not normal for her with oxygen use. So just printing out her last pulmonary visit notes and highlighting those key phrases, because that stuff's not in her care plan. It doesn't say she can't have 1 to 2 liters of oxygen overnight in her care plan, but it doesn't say that that might be needed every night. Whereas the pulmonary recent note, says, hey, look, this is kind of a normal thing lately. So it helps reassure them. So yeah, I need to print out some doctor's notes, highlight key things, the most recent doctor's notes, make sure all her prescription meds are labeled correctly, or there's a note letting the nurse know, hey, if you're looking at this label, it's not correct, and all her equipment. So I'll show you what that looks like after I get it done. It'll probably be on this video, so you'll see it now, even though I've got to go spend a few hours doing it.